or good morning, depending on where you are joining us from. I'm Molly Ramsdell, Director of NCSL's DC office, and I want to thank you for joining us on our last day of NCSL's State Policy 101 series. I hope you all have enjoyed the sessions over the last month, and if this is your first day joining us, welcome. I also want to remind everyone that you can go back and watch recordings of all the previous sessions. While we have some prepared comments this morning, I want to keep this pretty informal as we can, given the virtual world. So please make sure to use the chat and the Q&A function. You can find that chat box and Q&A tab to the right of the video player. Please use your full name and state when prompted to enter a nickname. Questions can be entered in the Q&A tab, and feel free to upvote any question you like. To get us started, I invite everyone to put their name and state in the chat. And while you're doing that, I'm going to review the agenda for today. I'm going to take a few minutes to talk about the work of NCSL in DC, how you as legislators and legislative staff can connect with that work, follow what's going on, and why it matters. This will be followed by a brief highlight of our work with the new administration, and then a timely update on the latest COVID-19 proposal, which is moving as we speak on Capitol Hill. And I want to leave appropriate amount of time for Q&A, as you all may have questions. One second, I went a little too far there. I also want to mention that my colleagues will provide some resources in the chat as we move through the program. So again, let's get started. Part of NCSL's mission is to represent the states and the legislatures in the American federal system of government. In simple terms, we are the voice of state legislatures in Washington, D.C. NCSL does this by taking the policies developed by one of the 8 standing committees and adopted by the conference, and advocating on behalf of state legislatures before Congress and the administration, and in some cases before the US Supreme Court. And while we have policies on many state federal issues, they all basically fall under the umbrella of ensuring state flexibility, avoiding unfunded mandates and unwarranted federal preemption, and strengthening the state-federal partnership. All of our official correspondence to Congress and the administration based on our policy can also be found on our webpage, and someone's going to put a link to that in the chat in just the next few minutes. The next slide just shows a few ways state legislators and legislative staff can connect to our work in Washington, D.C. In addition to us advocating on behalf of state legislators, we want you to know that we're here to serve as a source for information on what's going on in DC. First and foremost, if you aren't already receiving NCSL's Cap to Cap, please reach out so we can get you on the mailing list. It's an email that's sent out on Monday afternoons and provides a wrap-up of activities in DC from the prior week. And we do pride ourselves in trying to report on some things you might not read in the mainstream media. We also post on our website and make available through Cap to Cap summaries of major pieces of legislation, focusing on the provisions that are of most importance to states. Most recently, it was the December enacted COVID-19 and appropriations bill, and we've also even recently written a blog summarizing the immigration proposal introduced last week. Also, please don't hesitate to reach out to us if you need help connecting with someone in a federal agency, or you'd like us to brief a state committee on an issue. Again, we are here to be a resource for you. And why this is so important is that what goes on in Washington, D.C., funding-wise and policy-wise, impacts state legislatures. And I'm going to ask Erlinda Doherty to introduce herself and just talk a little bit about this next slide. Erlinda?
Yes, good morning, or good afternoon. Thank you, Molly. Happy Friday. Thanks so much for that introduction. I'm Erlinda Doherty, the Director of the Budgets and Revenue Committee in our DC office. And these larger federal appropriations, revenue, tax issues are part of the large account that I handle or that I cover for states here in our DC office. And as Molly mentioned, obviously one of the major items that we care about at states is where the federal dollars are coming from and how they flow down to our states. So we've got two good graphics here to kind of show how federal spending is actually divided up. And although these slides are from FY 2019, they still absolutely apply because of the portions or the ratios of funds really stay about the same almost every year. So as you can see here on the left-hand side, components of federal spending, really mandatory spending or funding that is actually already pre-appropriated, before the authorizing and appropriations committees can do anything, really stands at almost 2/3%. So this is basically automatic funding that goes to Medicaid, Social Security, interest on debt, and programs like that. So again, these are all basically pre-program spending that has to occur according to law every year. And the discretionary amount, or that is the amount of funds that the Appropriations Committee actually has control over and has to enact upon every year, is about 30%. So that's a pretty small pie or piece of the pie considering. And then you can see here a little bit more broken down on the right is exactly how those discretionary versus mandatory funds played out that year, with defense spending being a very large part of discretionary funding, really a huge part actually. Okay, so next slide, please.
Thanks,
Great. Molly?
Arlinda.
Yes.
Yep, thanks, Arlinda. So I want to move on to now to talk a little bit about two things we're working on that are really taking up a lot of our time. And obviously that is a transition to a new administration, as well as continuing to work on COVID-19. On the transition front, NCSL has developed transition papers on more than 24 issues. These papers provide an overview of an issue, a summary of NCSL's position, and in many cases highlights that states are leading the way in many of these policy areas. If you're interested in knowing NCSL's position on an issue, this is a great starting point to learn more. And there is going to be a link put in the chat if you want to check out those position papers. The other item, obviously front and center, is COVID-19, not just the former packages enacted, but also the one that is being potentially voted on by the House this week and the Senate next week. I'm going to turn it back over to Arlinda to provide an update on what's going on, discuss the general fiscal relief, and then we're also going to hear a little bit about the education and healthcare provisions in the bill. So, Arlinda?
Yes, thank you. Well, we have an infographic here that tried to depict exactly where this large $3.4 trillion in total COVID-19 funding that has trickled down to states, to businesses and localities and citizens. You can see here the various rounds with, of course, starting almost a year ago with round one, $8.3 billion that were basically supplemental appropriations for FY20 that really kicked off the funding cycle and the resources going down to states, citizens, and localities. March 18th, we had round two, which was the first, really big policy-focused, program-focused chunk of resources that went down. The Families First Coronavirus Response Act, or FFCRA, which we will be talking a little bit more about later too. And of course, March 27th, or round three, was really the big piece that we talk about even now that created a lot of the programs that we refer to, including the Coronavirus Relief Fund that provided $150 billion to states for COVID-related expenses. It also created the Paycheck Protection Program, a lot of the stimulus checks, as well as other health-related education funding as well. So that was $2.2 trillion, and to date has been the largest of the rounds of funding that have gone down to the states. Of course, we call it the CARES Act. April 21st, we kind of call that 3.5 because it was basically just a an enhancement or a re-supplemental, infusion of cash into previously enacted programs like the Paycheck Protection Program and some other healthcare funding that was put in there, as well as some of the direct funding for virus protection and enhanced education programs as well. And then finally, right before we finished the new year, round 4, we took it to the bitter end, of course. Congress enacted a combined COVID-19 relief proposal and omnibus appropriations that funded the remainder of government operations through FY21. And that was, again, $900 billion, not a small chunk of change that has gone down to help states, citizens, localities, and businesses mitigate the effects of this virus, to total about $3.4 trillion. You might hear, a couple of million dollars here or there, but generally speaking, $3.4 trillion is the total amount of resources that have now gone down to states. And to talk a little bit about the most recent round that we're in now, I guess that would be round 5. We are currently, the House is voting today on the next, or I guess that President Biden's proposal, that $1.9 trillion proposal that he had proposed while he was still campaigning, and now has actually come to fruition in legislation, which provides another $1,400 in direct payments, extends pandemic unemployment programs, tax credits for families and employers who offer paid leave, funding, of course, for state and local governments in the amount of $350 billion. And then a couple of more controversial items like the minimum wage increase, which we found out yesterday, the Senate will not allow that to be included in the jurisdiction of this bill because of very strict budget reconciliation guidelines. So currently, as it stands, the House is voting on this program today, or this proposal today. The Senate is supposed to take it up next week, but they will have to figure out how they're going to work out the fact that the minimum wage provision is not now going to be allowed to be attached to that bill. And so they're now considering offering that up as a sort of tax cut related issue or tax related issue for businesses. So that's another tactic that they're trying to take. In addition, CBO, the Congressional Budget Office, scored this next round of COVID relief as being above the budget reconciliation guidelines with respect to the dollar amount. So $30 billion have to basically be found somewhere and cut from the original proposal to make up for that. And also there is now another complication, a risk of sequestration, because this, again, going above the limits that were put in by the 2010 PAYGO law that requires that any increase in the deficit be mitigated with cuts or revenue increases in other areas, basically would trigger a $381 billion across the board cut for all agencies, and Medicare would actually be subject to this cut as well. So there's still some issues as we go into this next week with the Senate. So stay tuned as we continue to track and monitor the developments of this next big round, or round 5 of COVID relief for states, citizens, and businesses.
Thanks, Linda, for that timely update. We're going to just take a little deeper dive on a few of the provisions that are in this proposal, starting with education. So I'm going to turn it over to Austin. Austin, would you introduce yourself and tell our listeners a little bit about the education?
Yeah, thanks, Molly. I'm Austin Reed. I'm the Education Committee Director here at NCSL. Right now in DC, the education discussion in both Congress and the administration is solely focused on COVID-19 response. So I wanted to provide you all with a little update about how that affects states, both in the stimulus package, but also a couple relevant items that we've seen from the Department of Education over the last couple of weeks. So in terms of stimulus funding, the proposed next round of stimulus would provide about $130 billion to K-12 education, which is about 3 to 4 times what Congress usually spends on K-12 education annually. That would be on top of the already $67 billion that have been appropriated to K-12 COVID response over the last couple of stimulus packages. So there's a significant amount of money in this proposal and in the proposals already for K-12 education. That money would be sent out the same structure that it has been so far. It'd be 90% of those funds are going to go directly to districts, and states, at least the state education agencies, have the option of reserving about 10% of those funds as a set aside. And those funds all go out via the Title I formula. So it's factors in student poverty in terms of how these funds are sent out. There's also a proposed $40 billion for higher education. That's on top of the already $38 billion the previous two stimulus packages have provided to higher ed. That funds goes right out to the institutions themselves, doesn't pass through the state. Just about every institution is eligible. Essentially, if an institution can receive federal student loans, it will receive funding under the stimulus proposal. And those funds are also sent out based on both the headcount and full-time enrollment of students in both Pell categories and non-Pell categories, which is another proxy for poverty. One thing to note on this proposal, there's not going to be a governor's education relief fund nor a private school relief fund like we saw in the previous stimulus package. So something to keep an eye on there. In terms of use of funds, the K-12 funds will pretty much be able to be used the same way that they were before. Essentially, the way that it's been described, and I think to me in practice at districts, is there's very few things that these federal stimulus funds can't be used for, so they're very flexible. One new thing that districts have to keep in mind is they have to set aside 20% of their funds to deal with learning loss. So that's an important note. And they also have to reserve some of their funds to provide what's called equitable services to low-income students in private schools. So if the district is providing specific services to its low-income students, it also needs to provide those services to any students that would attend its district, that would attend this district but are attending private school. So that was a little bit of a complication last summer. Hopefully it's not this summer. The other thing is that states have to reserve at least 5% of those total funds for learning loss as well. One interesting thing we're seeing is that legislatures are starting to get involved with how state agencies are using this set aside. We've seen at least one state that has directed the state agency to use their set aside in a particular way. And I know some other states are kind of interested in this. So it'd be interesting to see how this plays out over the next couple of months. In terms of the higher ed funding, one of the most important things to know is that at least 50% of those funds have to be used on providing direct aid to students. This is especially true if you're a for-profit institution. You have to provide 100% of the funds you get through the stimulus package to provide emergency relief to students. That emergency relief for students can be used on just about anything that would be considered under a student's cost of attendance. Really important thing for states to know is that these funds can also, for the higher ed institutions, can be used to replace lost revenue. So if a state does have to cut funds to its higher ed institutions, the institutions themselves can use their stimulus funds to compensate for any of those revenue reductions that they might see. Other big thing we're watching for states is the maintenance of effort provision and the maintenance of equity provision, which is new. There's another maintenance of effort provision here. It essentially says that states have to maintain the same level of spending for fiscal year 22 and fiscal year 23 on both K-12 and higher education at the same levels that they provided in the 3 years prior to the pandemic. And this maintenance of effort can be waived. We're also watching a new provision called the maintenance of equity, and we'll see if this ultimately is included in the final stimulus package. There's some pretty strong concerns that this might not make it, might not qualify or pass what's the qualifications for a reconciliation bill. So we'll see if it's ultimately included. But it's interesting. It basically says that a state can't disproportionately cut funds for high poverty districts compared to lower poverty districts. And it also says that any state or any school that's considered to be in the 20% of most low-income districts, or a district that serves the most low-income students, can't have its funds cut below the fiscal 19-year level. So we're watching that. And finally, just want to talk about some things from the Department of Education. Over the last couple of weeks, the CDC did update their school reopening guidance, and the Department of Education also provided some complementary materials. Kind of the high-level summary is that the CDC said that if schools can reopen safely without vaccines for teachers, if the safety mitigation strategies the schools are using are employed well, and if community spread is sufficiently low. The education COVID handbook that came out from the Department of Education kind of complements the CDC guidance and provides some more practical explanations of how schools can actually implement the guidance. That was something that a lot of states and districts had asked for, and so this is something that the department is doing to respond to that. And then finally, the other thing that everyone's been watching from the state level is whether the federal government will offer assessment waivers and accountability waivers on those federal assessment and accountability provisions. Essentially, there will not be blanket waivers on state assessments. States will be able to exercise some flexibility as to how and when they administer those tests. But there is an opportunity, I think, for states to work one-on-one with the Department of Education to get flexibility beyond the guidance that's been issued if they desire it. So that's something we're going to be watching. And on the accountability provisions, essentially, states do not need to attach any consequences, at least from the federal government's eyes, to their accountability systems. They don't need to identify schools for improvement this year, And they are required, though, to maintain their report cards so that parents can have a sense of where students are at. But in terms of actual teeth to the accountability provisions, those can be waived in the eyes of the federal government. So a lot of things happening on education, and we're going to continue to watch that at the federal level.
Thanks, Austin. Appreciate that. Now we're going to take a couple minutes and move on to Health and Human Services. And I'm going to ask Haley to introduce herself and share with our audience a few updates on Health and Human Services.
Thanks, Molly. Hi, everyone. I'm Haley Nicholson. I'm the Senior Policy Director for Health and Human Services in the DC office. Since we're on the theme of reconciliation, you can see on the right-hand side of this slide, couple of different provisions in funding, including for funding related to vaccination and treatment, and a specific funding proposal for state, local, and territorial public health departments. This is to help either establish, expand, or maybe sustain their public health workforce, as there's been a lot of feedback that workforce, especially with vaccination rollout, will need to be increased in some communities. Also, different funding for Indian health services, additional funding going to programs like the Maternal, Infant, and Early Childhood Visiting Program, also known as MICV, and an amendment to the Social Security Act to increase total funding for child care entitlement program. Could you go back to the slide? Thanks.
Yep, sorry.
That's okay. It's technology, work from home. And so this is just a handful of different funding for HHS programs in the reconciliation bills. If you have more questions, I know we're sharing resources, but always feel free to reach out after. The bills also included, and I say the bills because it's two different committees, House Energy and Commerce and House Ways and Means, cover different aspects of these issues, but in some of them, there was also Medicaid changes, including a requirement that Medicaid would have to cover COVID-19 vaccines, coverage, and treatment for COVID-19 with any cost sharing for another year, and allows states to extend health coverage for women that are enrolled in Medicaid for 12 months after the birth of their child. And previously, federally, it's been 60 days. So there's a kind of a catch-all for some very direct COVID funding in health and human service programs, and then some other additional Medicaid and insurance provisions in there as well. I want to just quickly connect this. How does this all connect to some of the work that we do in DC? We also all have our committees that we work with. Some people that you work with in the legislature or yourself may be on a committee, you may be familiar with these committees or hearing about them. Our Health and Human Services Committee, we have about 300 legislators and legislative staff all across the US. And some of the top issues that they have been focusing on this year. So when we advocate to our federal partners, when bills like reconciliation or others are proposed, looking at healthcare costs, access to affordable and quality childcare, prescription drug costs, behavioral health, substance and mental health, a number of different topics you can see on the slide. So what we do is our committee lets us know that these are priorities, and a lot of the people on the committee do serve on health and human services. Some of them are chairs of committees in their state legislatures. And then we also have different policies that we all use to advocate to our federal partners throughout the year. And that's looked at and revised and edited by our committee members, made up again of legislators and legislative staff. And so we look at these policies on a rolling basis. We also vote on them at a certain point in the year. They have to be passed, a bipartisan consensus. We, on Health and Human Services, we have about 15 policies up this year, including on healthcare and healthcare costs, federal regulation of tobacco products, health IT, data security, and HIPAA, and public health. So this is a very, very quick overview of here's a federal issue that's going on that my colleagues and I are talking about. How does NCSL incorporate all of your voices, the people you work with, your peers, your colleagues, to push this up to our federal partners? And I'll turn it back to you, Molly. Thank you.
Thanks, Haley. I really appreciate that. And thanks to everyone who has presented. At this time, we'd like to open it up to the questions from the audience, and we do have a few, so I want to make sure we leave time to get to those. Erlinda, the first one is for you. Could there be some clarity about the CBO analysis and how much is needed to cut from the package to avoid sequestration?
Right, so right now, again, $381 billion is slated to be cut automatically across the board unless the proposal can be trimmed. In the past, the Senate has basically just wiped the board clean, voting to basically just ignore that. But this requires 60 votes right now. So that uncertainty is still obviously very apparent. Exempted from across the board cuts are Social Security, Medicaid, food stamps, and veterans benefits, but Medicare and farm price supports are still vulnerable. So the CBO has been able to find, $80 to $90 billion in other areas that could be cut, but that's clearly not when they were doing their analysis. But that's apparently not enough right now to actually make the full proposal be not vulnerable to these cuts. So more to follow. The Senate again could decide that they're just gonna, ignore it or pretend like the deficit's not there. Again, they've done that in the past, but it's going to be hard to see how this all plays out next week. So more to follow, friends.
Thanks, Erlinda. And while people think if they've got any other question, this slide here, I want to introduce you to all the NCSL in DC advocacy staff. Several of them, while we only talk specifically about education, healthcare, and budgets and revenue, there are other policy experts on the line. So if you have questions about other issues, we've got a few more minutes. We're happy to take those questions. I also would like to ask you before you log off, the session evaluation, if you could please take a 1-question poll found below the video player. The results are anonymous and will just help us plan future programming. So we just ask if at some point during the day you can reply to that. Does anyone else have any questions for our policy experts? Just making sure here. All right, it doesn't appear there doesn't appear to be any other questions. So I'd just like to thank you all for joining us this morning or this afternoon, again, depending where you are. And please don't hesitate to reach out to our policy experts in DC if you need assistance on tracking federal legislation or connecting with people in Washington. And we hope you enjoy the rest of the programs that you participated in today. So thank you, and we hope to hear from you. Bye.